Happy Wednesday, everyone. Welcome to Soulibration. I am your host, Shameika Rhymes. So let me know how you've been doing this week. And first, I want to start off by, because it's near and dear to my heart, I'm from Asheville, North Carolina. So I want to give a big shout out to those that are dealing with this hurricane's aftermath and just praying for every one of you in Western North Carolina and East Tennessee. So let's kick this off, you guys, with letting me know where you're watching from and how you're doing. And let me know if you have ever dealt with hot flashes, if you've dealt with a lack of sleep, increased anxiety, weight gain in the belly area that you woke up one day and it's just there, everything hurts. I mean, the list goes on and on and on. Do you think you're in menopause or perimenopause or postmenopause? Who knows, right? So, before we get started, remember to share this with your network. And if you have any questions at all during the show, drop it in the chat and we'll get to them throughout. So, we're going to talk about today. Well, actually, it's October. So, October is Menopause Awareness Month. And so tonight we're going to take a look at menopause hormone therapy with a focus on bioidentical hormone replacement therapy. And so it's an alternative to the traditional HRT. So we're going to talk about the differences. We're going to talk about how both of them can help. But menopause treatments aren't a one size fits all. It's what's good for your body, from what I understand. So we're going to talk about that and how you can manage your common menopausal symptoms, maybe even some of the symptoms that other people aren't even experiencing. You just woke up one day and you have them. So stay tuned. I'm so excited to welcome Dr. ANJU MATHUR. She's a holistic and functional medicine practitioner, and she's been administering prescriptions that infuse her patients with long-term health. So, and she's also works with her company, Angel Longevity Medical Center. So, Dr. ANJU, or do you care if I call you Dr. ANJU?
No,
Okay, I'm just jumping in there. Welcome.
well, thank you. I'm very happy to be here.
Well, I'm super excited because there are, I'm sure, a lot of people tuning in that are going to want to know all about menopause. So again, guys, let me know where you're watching from. All right, we're going to start because the most common question that I always hear is, what age do women enter menopause, and what are the most common symptoms that they experience? I know that it's sometimes broken down into perimenopause, menopause, and post, but is it all just menopause?
Actually, the way we can describe it is basically fluctuating or declining hormone levels in a
Mm-hmm.
woman's body. And believe it or not, it can actually start as early as late 20s, early 30s, where people start experiencing anxiety, for example. They
Mm-hmm.
just start experiencing anxiety, irritability, sometimes mood swings. One minute they're happy, the other minute they're like screaming, and all sorts of things can happen. And that is a sign of declining progesterone
Mm-hmm.
hormone. And that's the first hormone that declines in a woman's body, is a progesterone. So, and I don't know if you ever heard of anovulation.
Mm-hmm. No, I've never heard of that.
Yeah, so anovulation means you're not ovulating. So
Okay.
this is why your chances of getting pregnant goes lower after the age of 30, 35, and so on, is because you're not ovulating. So the eggs are not being released from the ovaries. And the first symptom of that is progesterone deficiency symptoms like mood swings or even not able to sleep at night. So the
Mm.
first thing that my patients complain of, I see women as early as early 30s to late, 60s, 70s. I even have
Mhm.
a patient who's 84 years old. And
Wow.
yeah, and I'm treating her with bioidentical hormone replacement therapy. So we have all age groups, but the thing to remember is simplicity is that the hormones start fluctuating or they start declining steadily, and that's what sets the person up for different symptoms that are related to hormone deficiencies. Traditionally, the menopause means that you have stopped having periods, right?
Mhm.
You stop having periods for at least 12 consecutive months. And that's what is traditionally called the menopause. But when we are talking about menopause, perimenopause, or postmenopause, we are talking about hormones that are declining. So there could be 10 people experiencing menopause, but they
Hmm.
could be experiencing symptoms related to different hormones.
Oh,
So
okay.
a woman could be in postmenopause, but she could have a great testosterone levels, but not enough estrogen or progesterone. So you have to kind of assess each individual person and see what they need. And so that's how we work with different age groups of women.
Okay, yeah, I can relate to the not sleeping because that literally when I went to the doctor, I was like, I can't sleep. And that's what she said. Progesterone's low.
Yeah, yes, that's very very common. I mean, you start getting into your mid 30s, late 30s. The first symptom that shows up is
Hmm.
that you cannot sleep. Actually, the way you can differentiate whether it is estrogen deficiency or progesterone is that the progesterone deficiency causes several wakings during the night.
Hmm.
Like you keep waking up. So it's hard to stay asleep, but
Hmm.
not hard to fall asleep. You fall asleep, but then you wake up and then you can't fall asleep again. And so that's very very common. People come and tell me, oh, I can sleep, but then I wake up in like a 4 hours and then I
Yep.
can't go back to sleep.
Uh-huh.
So that's what happens.
That's my life. Yes. Yes. So with the perimenopause, because I hear sometimes women are like, "Oh no, I'm not in perimenopause," and they're like 47 years old. So is that possible that they're not in perimenopause at that point?
Well, perimenopause is just a term that designates women who are closer to menopause.
Okay.
They're not completely stopped the periods, but they are kind of getting irregular periods, maybe too much bleeding, maybe too little bleeding, the spotting in between, various different things that can happen with your menstrual cycles. And that starts when your hormones, again, like I said, they're fluctuating or they're
Mhm.
declining steadily. And that's perimenopause. So anything that's close to menopause, but not technically, you can't call it menopause because they haven't
Mhm.
stopped their periods for 12 consecutive months, but they are close to getting where the hormone starts going down, and that's what's happening with perimenopause.
So what about for those that have had a hysterectomy that still have their ovaries, but they decided to keep the ovaries. The ovaries are functioning fine because they've been tested and hormones have been tested. Everything's fine. Are they in menopause?
No, the menopause means that the ovaries have stopped working in
Okay.
terms of production of the hormones. That's menopause. So the uterus, the hysterectomy means the uterus was removed, right?
Hmm.
So the uterus is only a womb. It's only a place where you carry the baby, right? But
Okay.
it's not where the hormones are being produced. The hormones are being produced in the ovaries. So that if you have your ovaries, you don't have to worry too much in terms
Hmm.
of, is that the hysterectomy has accelerated the process of menopause. I don't think so, but there is I mean, surgery is surgery, right? So you get your
Right.
uterus removed, and there is obviously some compromise with the blood flow and the blood
Hmm.
supply to the ovaries, so it can start declining earlier than somebody who had never had hysterectomy. That's definitely a theoretical possibility, but and it is seen. Sometimes you do see that, but also is mentally people don't know the difference between the removal of the ovaries, which is a separate thing, than just hysterectomy, which is just removing the uterus. So if you get your uterus removed, it doesn't mean you're in menopause at all.
Okay. All right. I did see a question about progesterone. Shelly wants to know, is progesterone recommended for women who have had a hysterectomy? Because I've also heard kind of two different things, that if you don't have a uterus, you don't need to take that. But I've also
Oh,
heard if you're not sleeping, you need to take it.
okay. So symptoms is one thing, right? There is
Mhm.
symptoms happening. The symptoms could be happening for various different reasons, but the other thing is you have to test yourself. In other words, the testing needs to be done to see what are your levels of progesterone.
Uh-huh.
But I think the question might have been this, that if you had your hysterectomy or your uterus removed, then when you go into menopause, are you supposed to take progesterone or not? Am I
Mhm.
right?
Shelly,
I
is
think
that
that,
what you meant? I guess so. I guess
yeah.
that's what she's
Yeah,
asking.
because the reason I say this is because I know the mainstream doctors are recommending to the patients that if you have had a hysterectomy, you don't need to take progesterone.
Mm-hmm.
But that is far from the truth, because the receptors that are on the cells for progesterone are not only in your female genital areas, but it's also in the breast. So it's not like you got your uterus removed, but you still have your breast. So in order to protect the breast from any kind of growth or proliferation, if, for example, in fibrocystic disease of the breast, you have lack of progesterone that's causing that problem. So in order to protect your breast from the estrogen therapy, for example, right, in menopause,
Mm-hmm.
you should absolutely take progesterone.
Okay. All right. Well, I told you I was going to ask this question because just in case any men are watching, but do men go through something similar as what women go through? Menopause, peri, post, all the pauses. Do they deal with this? Because I'm convinced they've got to.
Believe it or not, there is a term for them, and it's called andropause. So andro
Okay.
is for men, and some people like to call it menopause. Instead of menopause, it's menopause.
Hmm.
And they do have a pause in their hormones. They do have a pause. It's just not as dramatic. In women, it's very dramatic because you don't have your periods and it's a big deal and all of that. You don't ovulate anymore, so you're not fertile anymore. But men also go through similar changes, even though the changes in men happen later. So in women, the typical age for menopause is 50 years. But in men, the hormones decline very, very gradually. So it's not as dramatic as in age 50, but most men have testosterone deficiency by the time they turn 60.
Hmm.
So it's very common and it is called andropause. However, I am seeing patients in my office that are much younger than 60 who have problem with their hormone levels. And they have significant decline in their muscle strength or physical stamina, or even brain fog. So women go through brain fog, and similar things happen also for men. Their mental acuity changes. Like if you have some CEO, top executive who's running like 100 miles an hour, and then they turn 40. By
Hmm.
the time they turn 40, their mental acuity and the speed of mental thoughts and the processes decline significantly.
Okay.
So I have men coming into my practice and telling me about this. So we test their hormone levels, and we want to know, okay, what is your testosterone level at this point? And then we see, okay, let's optimize that, and
Hmm.
then see what happens. And then bingo, I mean, as soon as this is all balanced, their mental acuity comes back, the brain fog goes away, they can think faster as they did when they were younger. All these things are very significantly seen in people.
Okay. Wow. And guys, if you have questions for Dr. Anju, please drop it in the chat because this is so interesting to me. So, in your role as a functional and holistic doctor, so what steps do you take with a patient? Say I walk into your office and I'm like, I have brain fog, I can't sleep, I have night sweats, my mood swings are on a roller coaster. All the things. What is the first step that you do? I mean, obviously we'll probably talk about the symptoms, but can you talk a bit about testing the hormones, what that looks like, and how women or men, when they go to the doctor, what to ask for to be tested?
Um, that's a tough question,
Okay.
because if you go, I mean, the simple answer that I do is very simple, right? We check their
Mhm.
hormone levels. The hormone levels can be tested three different ways. You can test your hormone levels in your blood, right? For women, as a side note, for women who are ovulating or who are menstruating, for example,
Mhm.
menstruating, then you have to check the hormone levels when they're supposed to be at their peak, which is day 21, for example.
Mhm.
So you're going to check your hormones in the blood on day 21. That's one way, standard way of doing it. Then there is two other ways that you could check your hormones and get it tested. Is one is you can test it in the urine, because the hormones do get metabolized and processed and basically eliminated through the urine. So we can check all the hormones and the metabolites or the breakdown products in the urine to say, okay, this is what it should be coming out, but it's not coming out. It's too low or it's too high. Different things can happen in the urine. And the third way of testing is the saliva. So you can test the hormones in the saliva as well. And so again, if you're menstruating, there's different ways you can test it. If you're not menstruating, then it doesn't matter. You can do it any day.
Oh, okay. I didn't know you could test it through the saliva. I'd never heard of that before.
Yes, so you can
Okay.
collect the saliva, you can test it in the saliva. We actually have all the hormones that we can check in saliva, including the female hormones, but there's other hormones you can also check, like for example, adrenal hormones. So you can
Hmm.
check cortisol, cortisone, different metabolites of cortisol in the saliva as well as the urine. So we have very extensive detailed testing that we
Hmm.
can do for men and women.
Hmm.
And you just have to kind of know that there's different times that you have to check the hormones, and it should be correct for that particular person.
Okay, because I think, see, I just had brain fog because I had the question in my head and I was like, wait, where did it go?
You just do this and it comes back.
Right, right, exactly. Yeah. Yesterday I was just walking around like I had a hand towel in my hand, but where did it go? I left it on a doorknob, like the other end of the house. And I was like,
Yeah.
how did it
Oh
get
my God.
here?
Yeah. Yes. Yeah. This is very common. People complain about the brain fog so frequently. It's
Mhm.
amazing. Yeah.
Yeah. So there's another question from Shelly. She said, can cholesterol change due to menopause? And if so, what can be done to lower it?
That's excellent question. I really like this question because I don't think women are aware that the estrogen and the progesterone actually gives you a protective layer
Hmm.
from heart disease, right? From heart
Hmm.
disease, from getting a heart attack or stroke. Even though cholesterol directly doesn't cause it, right? The underlying problem is different, but high cholesterol can contribute to high incidence of heart attack and strokes. And that, very interestingly, when you are menstruating and you are premenopausal, your cholesterol levels more than likely would be within normal range.
Hmm.
But when you turn into postmenopause or menopause, the cholesterol levels are affected, and they do start going up right when you stop having your periods, because the estrogen gives you estrogen gives you a protective layer to act. So if you look at the statistics, men have a higher incidence of a heart attack and stroke, right? In
Hmm.
their, let's say in their 40s or
Right.
50s, they're high incidence as compared to women same age. But when you are menopausal, the incidence of heart attack and stroke is in women is higher than men same age.
Oh, okay.
So if you take,
Wow.
yeah, so if you take a 50-year-old woman and a 50-year-old man, the woman would have a higher incident, a higher risk of getting a heart attack and stroke if she is menopausal.
Hmm.
If she's not menopausal, then the risk is lower in women. So just logically speaking, it does. I mean, of course, there's tons of studies that show the same thing, is that you have a cardioprotective role of female hormones in
Hmm.
a woman's body. So that's very clear. And this is why, so most women are afraid of getting breast cancer, right?
Hmm.
This is a big button. People think, I mean, women think that they're going to get breast cancer, and so they are very concerned about
Yeah.
that.
Hmm.
But most women don't know that the reason why a woman over 50 or a woman who is in menopause can die off most frequently would be from a heart attack, not from breast cancer.
Oh, wow. And Shelly just added an additional comment because her cholesterol has increased, and she said her endocrinologist prescribed her some medicine to lower her cholesterol, but she's afraid to take it.
Yeah, I don't.
Shelly, are you, Shelly? I assume you're in menopause, and maybe that's why the cholesterol has increased. So should she would medicines? Because I know sometimes you know doctors do just prescribe. I had mine even say, it went your cholesterol went up a little after my hysterectomy. We can talk about taking cholesterol medicine, but ultimately I didn't because I was able to lower it with diet and exercise, but I didn't have to and I opted not to. But do you suggest that someone like Shelly, like she just mentioned, her doctor prescribed it, so should she take it?
Well, obviously, I can't give any medical advice
Right.
here on the show for a
Right.
particular patient. I can't really do that. But
Exactly. Yeah.
in general, yeah, the cholesterol lowering medications and drugs have a lot of adverse effects.
Okay.
So you should be researching that. Like, what are the side effects? I know a few from top of my head is the statin drugs or the cholesterol lowering drugs
Hmm.
can increase your risk of getting dementia,
Hmm.
and it can also increase your risk of getting diabetes.
Okay.
So, and then they will increase your risk of getting calcification inside your coronary arteries.
Okay.
So all of these things are adverse effects. So if you could lower your cholesterol without using the drugs, then that's the best. If you have a genetic problem and somehow you have a higher risk because of your family history or some other reason, and you do have to go on statin, then after you have done everything else to lower your cholesterol, and if nothing is working, sure. But there's many things one can do before going on the statin drugs to lower your cholesterol.
Okay, thank you. Yes, and absolutely. We'll talk about how people can reach out to you if they have like specific personal advice that they need. Now, let's talk about what I mentioned in the intro was, we're going to talk about hormone replacement therapy versus bioidentical hormone replacement therapy. What is the difference between the two?
Well, it's a night and day.
Hmm.
So the traditional HRT or hormone replacement therapy that has been used in this country for last 50 years and longer was the hormones that actually is very funny that one of the hormones used in that HRT is called Premarin. So many of you might be familiar with that word. It's called Premarin, and it was a medication or drug that was used for over 50 years in America. And that the word Premarin comes from pregnant mare urine. It's
Oh,
pregnant.
sorry, that threw me off. I was like, wait, I didn't know it was going to go there. Sorry.
Yeah, it's pregnant mare's urine. So it's the urine of a horse. So the hormone that is in that Premarin drug is from a horse. So obviously it's not a woman's hormone. So how would you have, beneficial effect without having adverse effects? So there's four different estrogen hormones in a horse's body. They're called echoline estrogen hormones, and
Mhm.
only one of them is similar to a woman's hormones, estrogen. So the
Okay.
other three are synthetic or foreign to the woman's body.
Hmm.
So if you can imagine, if you put something that's not a part of the body doesn't recognize it, and it doesn't know what to really do with it. It will try to metabolize and get rid of it, right, as much as it can, but it's not going to be able to do all of it. So this
Right.
is why you get the adverse effects of any synthetic drug that you put in a human's body.
Mm.
So
Okay.
Premarin was being used. So then finally the study came out, and I think it's 2005, the WHI trial, Women's Health Initiative trial that came out, and then they basically released this information in the media about the hormones are bad. But
Mm.
the hormones that were used in that study was horses' hormones. At least the estrogen hormone was the Premarin, which is a pregnant mare's urine. But the progesterone, which we both know is a progesterone, which is a human hormone, that's not what was used. It's called Provera, which is a synthetic version of the hormone progesterone called progestin.
Hmm.
So the women were being given the horses estrogen, and they were being given synthetic progesterone. And so there was a lot of side effects, right? There is breast cancer, there is strokes, there is liver problems, there is clots. All these things were happening, and so the trial was ended prematurely because of the significant risk of the cancer and other things. So this was released, and the people were afraid now to use the hormones because of the side effects.
Right.
But what was not shared in the media was that these exact things that I mentioned is that these hormones were not natural to the human body. So now, fast forward, uh, it's not even that fast forward. I mean, it started in 1970s, late 1970s and 1980s, that Dr. Jonathan Wright, he was a pioneer in the bioidentical hormone replacement therapy. I mean, he still is. And he started using the bioidentical because the patients demanded it. And so they asked for Dr. Wright to have some kind of hormones that are natural to the human body.
Mm-hmm.
So he researched into it and he got this started. And so now we use bioidentical, which means they are exactly the same copy as we have in the human body.
Okay.
So they are
Okay.
human hormones. They're not a horse or some other animal's hormones.
I'm like, because you had me scared for a second. I was like, okay, when this is done, throw all of it out.
No, that's just a generalization of hormones. It's not really hormones. I don't think they are hormones. They're like, yeah, synthetic progesterone is not really a hormone. It's a drug.
Hmm.
And they just have hormone-like effects in the human body. That's all it is. So they call it hormones, but they're not really hormones. They're actually synthetic drugs with a hormone-like effect on the body.
So the progesterone prescriptions that we get to help us with our sleep and when our progesterone is low, that's not from a horse, is it?
Well,
That's from
no. So now the big pharma has started making progesterone, but what's happened is that they obviously it's a big pharmaceutical drug, but
okay.
what's happening is that they're basically giving one size fits all. So everybody takes the same dose, no matter what your shape or size is of the
Hmm.
body and how much you can tolerate. So we use something called compounding pharmacies, which are basically compounding the exact dose that your body requires. So the best way to do bioidentical hormone replacement therapies is through compounding pharmacies.
Okay. That makes sense. Well, what about the pellets? I've heard a lot of people talk about getting the pellets injected. So from I guess it's just it's I don't know the word I'm looking for. I don't know if if it is compounded. I'm not really sure, but I don't. But it's for their specific body.
Yeah,
So.
I mean you can titrate the dose on the pellets for that person for sure,
Mhm,
depending on how many pellets you're going to put in.
mhm,
But I mean, personally, in my practice, we don't particularly recommend that you do pellets. You can do pellets if you want,
mhm,
but personally, I don't prefer it. It's not the preferred method of administration for
mhm,
me for multiple reasons. In my mind, when we started doing pellets, I did pellets a few years ago
mhm,
when I started doing the bioidentical hormones, but then I realized that the absorption rate is not really uniform in different patients. So it could
mhm,
vary how much is going to get absorbed. You can't control because once you put the pellet under the skin, it just stays there for next 3 to 4 months, depending on your
mhm,
body. And
mhm,
so the rate of absorption is not really standardly, you can predict it standardly for all people. So I decided, and the second reason, the downside of that was that you have to now cut somebody's skin every three to
mhm,
four months
mhm.
and I didn't want to do that because it is invasive. When
Right.
you cut the skin, it's invasive. It's not natural. So I didn't. So I basically diverted off of that, and I don't do that because the way we do it is that you can actually control
Mhm,
the levels and the doses on a daily basis. So you can vary the dose. For example, progesterone. I mean, progesterone is not part of the pellet. You can put progesterone in the pellet, but the estrogen, for example, you can control how much estrogen you're going to put on your body, right?
mhm,
On your skin. It's a topical cream. I know that sometimes I get patients who are being given estrogen as a pill, and that's a very bad thing to do. You
mhm.
don't do estrogen as a pill. It should be done topically in a cream or a pellet, but taking orally is not a good idea.
Can you
Um,
do the patch for
the patch, you
estrogen?
can do the patch. Yeah, you can do
Okay.
the patch. But again, once again, patch is same problem, absorption and the dose may not be exactly what you need. So you need to adjust the dose by doing
Mhm,
the hormones on a daily basis.
mhm.
And I mean, it's very simple to do that. And so then you can monitor and you can control what
Mhm.
levels you want in your body.
Right. Okay.
Like I'll
Some,
give you example. Like I once had a patient. Sorry to cut you off.
that's okay.
But I had just thought about a patient that came in and she had, I think she had uterine cancer or something,
Mhm,
and she went and got the hysterectomy, and then this was in Texas, And she came back to see me after surgery, and she told me she had pellets put in right after the surgery. And I said, whoa, wait a minute. And then she was having a lot of side effects because there was too much estrogen and too much testosterone.
Mm-hmm.
That poor lady, she says, okay, doctor. And so I checked her levels. They were significantly elevated, like 5 times the normal levels.
No.
And I said, okay, Jennifer, this is not, the normal or optimal levels for you. And with pellets, she said, what can I do? I said, I don't know. Once you put the pellet in, it's hard to take it out. But
Yeah.
she said, no, don't worry. I'm going to go back to the same doctor and I'm going to get her to remove my pellets.
Oh my
And
God.
I said, it's hard. Once you put the pellet in, you can't take it out. She said, don't worry, I'll be back. So she went back to Texas, made the doctor take her pellets out. And then she came back and we have been treating her since then and she's fine. But so the pellets, this is why I don't really prefer the pellets, because you can't
Okay.
really control it.
Okay. We've got a couple questions. Let's see. Kalandra, and I'm probably pronouncing your name wrong, so I'm sorry. How do birth control pills help with perimenopause?
Yeah, so this is a standard of care that they think that anybody has who have problem with their menstrual cycle, or they have any kind of I don't know what are the reason. I think the other reason they would, if you start having too much bleeding, if you have a
Mhm.
heavy flow around the menopause or perimenopause, they say, okay, take the birth control pills, control that, right?
Yeah.
But once again, the birth control pills are synthetic. They are not human hormones. So to put people, and I see this every single day. I have patients that come in and they tell me, oh, my doctor put me on birth control pills because I'm now 50 years old.
Mm.
And I was like, okay, so you are 50 years old, your hormones are declining. And how does that make sense to put synthetic hormones in your body while the natural hormones are available? If they were not available, I understand. But we have availability of all the natural hormones that you can
Mhm.
get from compounding pharmacy. And plus, the birth control pills don't really handle your menopause. They don't handle your menopause. They can handle one thing, which is
Mhm.
okay, too much heavy bleeding. Okay, great. That could be brought under control. But they are, again, synthetic hormones. They're not going to give you the protective layer that you want
Mhm.
to reduce your risk of getting dementia or Alzheimer's or get osteoporosis or
Mhm.
get a heart attack or stroke. So all those things are done by natural hormones. So the natural hormones, when you take bioidentical hormones, they reduce the risk of all those age-related degenerative diseases. So, but if you take birth control pills, they are synthetic. They don't give you those protective layers, right?
Right. Okay. Wow. Let's see. We've got Terry Moore. She just joined. Welcome, Terry. She's having hot flashes 6 times a day. So, how can she stop it? And let's also, that actually will piggyback on my next question, which was, are there any other natural ways to handle symptoms like that and other symptoms?
Well, absolutely. I mean, well, I just remembered one thing the patient told me. Oh, my gynecologist or my endocrinologist told me to tough it out.
That's when I would probably have a mood swing.
Yeah. And I was like, wow, really? They say, yeah, I tough it out. No, but there is many herbal therapies also that you can try. There is definitely herbal therapies. So uh, there is multiple studies that show that you can use some of the herbs. That I think a lot of people are aware. There is chasteberry extract,
Mhm.
which basically acts on the same receptors as progesterone does. So, but once again, it's not natural progesterone. It is herb. So you don't
Right.
expect a plant to have a life of a human, right? So it's a very two different species, but that same herbal extract will work on your receptors. So it can calm down those receptors, occupy those receptors, and do different things with that receptor. So there will be some modulation of that hormone in the body, but not to the extent you will get when you do natural progesterone. Does that make sense?
It does. Yes. Yes.
So
I'm sorry.
no, I mean, I'm just saying, I was going to say the progesterone and the same thing for estrogen. So there's many plant extracts that you can try.
Mhm.
And in fact, I have one product that I created myself, and it's called Menopro.
Mhm.
And it has a lot of herbs in it that I put in there for women, that are out there that don't have access to bioidentical hormone specialist.
Mhm.
But so I put soya asaflans here and red clover and different things. So
Mhm.
there's many extracts that you could use to see if it helps with your hot flashes.
Mhm.
But I think the amount of risk reduction is not the same or comparable to if you were to use BHRT. It is better than nothing, right?
Mhm.
You have some kind of diminished hot flashes or whatever, but it's not a complete protection. Does that make sense?
It does. It
Yeah.
does.
Yeah.
Someone else wanted to know. Oh, Shelly. Um, she said her doctor stated he did not want to put her on any HRT until she lost over 20 pounds. Are there any risks with taking HRT and being a certain weight? But
No,
isn't
no.
that, I'm getting mad now. I'm like, isn't that the point? We're gaining weight because we have in menopause.
That's exactly right. You got it. That's exactly the point. I mean, I had one time a patient who came in with very interesting symptoms of menopause or hormone deficiency. Plus, she had some other problems as well. But
Mhm.
we started doing her BHRT. She had come in with she said that she was feeling like a prickly feeling in the entire body, like her entire body was on a barbed wire.
Oh.
Yeah, that was very interesting symptom. I'm like, wow, okay, great. Well, let's balance your hormones, see what
Mhm.
happens. In a few months, obviously she was back to normal and herself, but she lost like 30 pounds of weight. And
Wow.
she said, I'm back to when I was 16 years old. And this is a woman who was like 50, 51 or 52 years old.
Hmm.
And she
Wow.
got back to her weight when she was a teenager. And I was like, oh my gosh, we're kind of disappearing in front of my eyes. She's like, oh, don't worry, doctor. I'm good. I feel great because that's how I was when I was 16. I was like, so it's the opposite. You want to balance your hormones so you can lose the weight.
Hmm.
Sometimes the progesterone deficiency will make you gain water weight. So you can gain weight not because you got fat, but because you gained the extra fluid in your body. So when you start balancing the hormones, you can lose all the water weight easily.
Oh, okay. Let's see. We have got a couple more questions. Well, there's another question about the controlling the hot flashes. So, Relisha says she had a hysterectomy in 2016 because of endometriosis. She's now 40 and hot flashes are attacking her. I'm so sorry. I get it after a hysterectomy. I'm so sorry.
Well, so I think the first step for her is to check her hormone levels and
Hmm.
then see if she's actually in menopause. There could be early menopause.
Hmm.
Like I mentioned earlier, after surgical intervention, there could be
Hmm.
some compromise to the blood supply to
Oh,
the
yeah.
ovaries, and that could start, the ovaries could start kind of dying or, disintegrating and things like that. But the first thing that she should do is check her hormone levels and see if she's in menopause, because there are tests you could do, like for example FSH,
Hmm.
follicle stimulating hormone. It's not
Hmm.
a estrogen, but it's a pituitary hormone that gets released from the pituitary gland. And when you go into menopause, the FSH goes higher. It's because it's trying to send the signals down to the ovaries to produce more estrogen.
Hmm.
But because the ovaries have failed, then the FSH starts going higher. So if it is over 25, then the chances for you to be in menopause is higher. So
Hmm.
you have to kind of judge all the different hormones, see what it is, and then decide what is the best solution.
Did you say that ovaries disintegrate? Sorry, I got stuck on that.
They're kind of failing.
Okay, okay.
They're kind of failing because they're not producing the hormones they're supposed to be producing. They kind of shrivel up. Absolutely.
Oh, okay. Well, I guess we wouldn't feel it though, right? It would just happen
No.
and you wouldn't notice. Okay.
Yeah, you wouldn't notice if you're having a hot flash or a mood swing. You're not going to think about your ovaries.
Right. Yeah, I'm more looking for let me just put my head in the freezer. Let's see. We have another question from Kalandra. She says, do vitamins such as magnesium help ease perimenopause symptoms?
So magnesium deficiency is very rampant in just about everyone. Very, very rampant. I don't know if it is because you know, a lot of promotion and advertisement of the dairy products.
Mm-hmm.
So the dairy products have a lot of calcium, and people also take a lot of calcium because the doctor tells them to take calcium to prevent osteoporosis. So I don't know whatever reasons they are, and people are more stressed out, so they are deficient in magnesium. A lot of people are deficient in magnesium. So if you take magnesium, it calms you down. Because magnesium deficiency can also cause irritability or anxiety and things like that. So there is overlapping. So it's not like a panacea. There's not like hormones are the only panacea.
Mm-hmm.
If you are deficient in certain nutrients, this is why we do holistic medicine, and it's called functional medicine. Is because we want to check all the different systems in the body, including your nutritional biochemistry. If there's any imbalances in the minerals, vitamins, we want to balance those out. So that way everything works together, and it's
Mm-hmm.
not just one thing. It's not like you're going to just take estrogen and you're going to be perfect. No,
Mm-hmm.
it's just one of the things that you should do. So I agree with the person that asked the question that, yeah, if you are deficient in magnesium, absolutely.
So, I think I mentioned to you earlier about testosterone. I know we were just talking about the pellets, but I've tried the testosterone gel, and that was back to your point of it not absorbing. It didn't absorb through my skin at all, and the little bit that did absorb, my hair started to come out. So, have you had patients deal with that? And in that case, when you do, your body just can't handle something like that, and I'm not doing a pellet because that just sounds too much. And my doctor personally doesn't deal with like the compounding and all that. So in that case, for someone with like myself with low testosterone, what would be the next step, or what would you tell your patient for that next step of how to handle that low testosterone? Because I deal with that, the irritability, some of the same things, and maybe it is part of it is the low magnesium. Who knows?
That's exactly right. So you do have to do extensive testing to find out what exactly you need, your body needs, and you have to balance out those different parts of the puzzle. But to answer your question, so there is another hormone called DHEA.
Mm-hmm.
Okay, it's a hormone that comes out of the adrenal gland,
Mm-hmm.
and that naturally it converts into testosterone, and more so in women than in men. So if women, usually I don't usually treat women directly with testosterone. I
Mm-hmm.
mean, sometimes they're completely like very low on it, then sure. But most of the time, I try to give, especially younger women.
Mm-hmm.
Younger means less than 55 or something.
Okay.
Then I would try to give them first DHEA and then see how the body converts that into testosterone. And if
Ah,
it is converting, great, you're good, you're happy. If not, then you do the other things. But
okay.
there's many ways to do testosterone, but it depends if the person is able to tolerate that without getting any kind of the reason the hair falls out
Mhm.
for testosterone, people who are being treated with testosterone, is because there is an enzyme called DHT.
Mhm.
Sorry, there is a hormone called DHT, and that is the one. If you increase the levels of DHT in your body, your hair will fall out.
Mhm.
So some
Okay.
people do that naturally. They convert the testosterone into dihydrotestosterone, which is DHT, and that makes their, like in my case, I can't tolerate testosterone because when I do that, my hair falls out
Mhm.
because of the increased levels of
Right.
this hormone called DHT. So now you have to do other things to block that conversion, right?
Mhm.
And if you want to do that, is great, no problem. You can do that. You can stop the conversion of testosterone into DHT, so you
Mhm.
can have the benefits of the testosterone without having your hair fall out.
Okay, because yeah, I was like, this has got to get out of here. I just grew my hair back after the hysterectomy, so I can't deal. But I felt like my whole body was just on fire when I was taking the testosterone. Like I just was hot all the time, and I was like, and my hair falling out. It was those few weeks that I was on it was intense.
I believe it. The
Yeah.
other reason could be also, like I remember now, this another patient that came from another state to see me because her sister, who was my patient, recommended to her sister in another state to see a BHRT doctor there. And so she did. She went to see another physician there. And then the first thing she was given was testosterone. And that made her completely crazy. And so the sister begged me to see her because she's not doing well on whatever she was being given. So I told her, okay, no problem, bring her in here. So
Mhm.
the patient flew from another state, I think it was Colorado, and then she came here and we treated her. So the what I noticed was the problem was not that she didn't need the testosterone. She did need the testosterone,
Mhm.
but the sequence of how you do the different hormone replacement therapy is as important as which hormones you need to replace.
Ah, okay.
So she was being given the wrong hormone first, and then the one that she needed wasn't being given. So it's just, this is why we do balancing. It's a
Mhm.
balancing act. You want to balance your hormones, not just, oh, I need this hormone like a panacea. No, it's not.
Mhm.
Does that make
Mm.
sense?
It does. It does. This conversation has been so good, and I hate that we're having to wind it down, but you have been amazing answering all of our questions. I didn't even hardly look at my list because everybody in the chat had some amazing questions. Thank y'all, co-host. So I asked this question. Well, first let me ask, because in case there's anyone that wants to reach out to you for medical advice, or if they're interested in getting the vitamins that you have, um, how can they reach you? How can they find you?
I think maybe I should give the website address.
Yes,
It's,
absolutely.
yeah, I think it's angellongevity.com,
Okay.
www.angellongevity.com. And then there is a phone number and there is an email address that you can
Mhm.
send your questions, and so go from there.
Okay, perfect. Perfect. So I ask everyone that is a guest on the show this question: what feeds your soul?
Sorry.
What feeds your soul? Like
Oh,
what
what
makes
feeds
you,
my
yeah,
soul?
yes, what makes you happy and excited, and just is it could be something that you're passionate about. It sounds like this is one thing that feeds your soul.
Oh, 100%. My passion is helping people
Uh-huh.
and helping them effectively. So I'm not, you know how the doctors feel sorry for their patients, right?
Mhm. Yeah.
Sometimes they feel sympathy and all this, which is fine. You can do that. But the real important thing for any person is to get an effective help.
Mhm.
So my passion is to give the effective help. I see all types of patients, not just for the BHRT. I see patients, cancer patients. I see autoimmune patients. There's all
Mhm.
types of patients that have no other hope because they've seen many, many, many doctors, and they come to me as a last resort. And so my passion is to bring that person back to life, you know. And
Mhm.
when they come back to life, it makes my day. And I tell them, this is amazing. Well, oh, thank you. You made my day today.
Oh, I love that. Thank you. I want to thank you, Dr. Anju, for coming on and chatting with us. You're gonna have to come back because I feel like the conversation there's still more that we could talk about,
Oh,
and
yeah.
this is Menopause Awareness Month. So I might just be knocking on your email. Can you come back soon this month?
Yeah, well, I would love to be part of the show again, and I would love to answer questions because I like to. So, the other passion for me is to get that information out there so people
Yes.
can actually benefit from this and they don't have to suffer any longer. They
Mhm.
don't. You can have any problems with the body, and it can all be helped with. It
Mhm.
may not be a perfect cure for it because, anyway, curing is like illegal in this country, but it's just, but the point is that you want to help and improve their condition so their quality of life improves. So my passion absolutely is to bring that information and the knowledge. So yeah, I would love to be back.
Oh, absolutely. I see everybody in the comments saying thank you. So, thank you, thank you, thank you. Everyone,
Thank
for more information on menopause, head over to blackdoctor.org. There's a ton of articles over there. And as for me, I will see you guys next week for a celebration. I don't have a topic yet, so that's why I'm not teasing it. But I'll see you guys next week. And let me know if there's any topics that you'd love to hear about, because obviously this one was a hot topic. So let me know what other ideas you guys are thinking about, what you're going through. And I want you all to have a soul filled rest of the week. Thank you, Dr. Anju.
thank you very much for having me.
Yes. Good night, everybody.